Cancer journey is never easy. I always say a cancer patient has two lives, before and after cancer. And it is the second life where the role of a caregiver becomes very, very important. So, who can be a caregiver, or how do we define a caregiver? As simple as that. Anybody who cares, somebody who cares for this cancer patient is actually a caregiver. Generally, this role is taken up by the spouse, by the parents, by the kids, by the children, by the siblings. Generally, it is the family member which steps in first to help the cancer patients. But nonetheless, in many cases, we also find that it is the neighbors, it is the friends which are the important caregivers for these patients. So, role of these caregivers cannot be undermined. Yes, the role of doctor and hospital is a lot in the journey of a cancer patient, but much more than that, there is an equally important role, rather, I will say, of caregivers and the family members. The most important thing that these caregivers need to do is to take care of the patient. So, taking care of the patient may mean taking physical care of the patient, taking care of the physical needs of the patient, taking emotional care of the patient, taking care of the emotional needs of the patient, emotional support to the patient, to keep them motivated, to keep them inspired, and help them in their journey, help them in their fight against cancer. And sometimes it may also mean taking care of the financial needs of the patient. There are a lot many times we see the spouses and the children stepping in to take care, to give financial support to their parents, to their spouses. So, cancer journey will require all of this, and all of this generally become a role of the caregiver. What a caregiver should do and should not do. What is important is, yes, a caregiver need to empathize with the patient, but what he or she should not do is, do not sympathize with the patient. They need your empathy. They need a shoulder to cry. They might need a shoulder to cry. They might need a ear to listen to their problems. They might need support for in scheduling their appointments with the doctor, with the hospital. They might need support for transportation, for traveling, for getting their drugs, for getting their medicines, and the support regarding cooking and so many other extra aids, and regarding their insurances also, probably managing the insurance papers and whatnot. So all these requires a lot of support, and this all is the role of the caregiver. So what is all very important is for the caregiver is to cut out the negativity, to keep the patient positive and to stay positive himself or herself. Yes, cancer journey is not easy, but yes, with the right set of caregivers, with people who care, the journey can be made very, very much easier to tolerate, and it can be made very much bearable, and many people can come out of it successfully. And any other important thing that I always say is caregivers need to take care of their own health too. They are also human beings. Sometimes they can also uh, get too much stressed, too much emotionally stressed. So they have to, their role has to be to keep themselves also motivated. They need to take rest themselves also, keep themselves also in good health so that they can take care of their loved ones.